Okay.
Well, my name is Ethan Borowski. I'll be your student nurse for today. Can you give me your full name and date of birth?
Leticia Rico, 1221.
Check your wristband. Okay, matches what you stated. Let me apply hand hygiene, apply privacy, and gather all my equipment. Then we'll begin. You already told me your name. Can you tell me where you are, why you're here, and what day it is?
It's Wednesday. I'm at Middle Georgia, and I'm here for a head-to-toe assessment.
You don't have any obvious physical deformities or anything. Your grooming and clothing seems to match the setting and situation, as well as you're looking at your color, pigmentation, it matches your ethnicity, and you don't have any abnormal facial features or anything like that. You're alert, oriented, conscious, and you're keeping good eye contact. It seems like your vision, speech, and hearing are all working. So next we'll start with the skin, hair, and nails portion. Do you have any skin lesions or anything like that?
No.
Okay. I'll inspect your scalp and look at your hair. Okay, the color looks normal. Hair distribution seems normal as well. Next, I'm going to palpate for temperature. Here. Okay, it's warm. Your skin is also dry. Seems to be okay. As well as pigmentation and color, once again, is matching ethnicity. Also, now I'm going to pinch under your collarbone, test for elasticity. Okay. Recoil it immediately. So turgor is good. And next I'm going to assess nails, so shape, color, contour, grooming all seems to be okay. Next I'm going to assess for capillary refill. Squeeze. Okay, it's less than 3 seconds. I'll do it on your toe as well. Okay, less than 3 seconds, and you don't seem to have any clubbing or anything, which is good. So next we'll move on to, and also the grading scale is so it measures skin breakdown, and the 3 parts of that are mobility, moisture, and nutrition. So next we'll move on to the general head and neurological portion. So first, looking at your head shape, size, symmetry, it all seems to be normal, symmetrical. Do you have any facial droop or anything?
No.
As of late? Okay, perfect. Next, I'm going to assess your ears, looking at your external ears. Okay, it seems to be okay. Next, we'll assess hearing. So we're going to do the whisper test. So I'm going to stand 1 arm length away behind you and cover 1 ear. Cover 1 ear, then I'm going to whisper 3 syllables. And then repeat. Okay, and cover the other ear. ABC.
ABC.
Okay, perfect. Do you have any hearing loss or anything as of late?
No.
Okay, perfect. Next, I'm going to assess your eyes. I'm going to do direct and then consensual pupillary light response. So I'm going to shine in your eye, look at that eye, it constricts, so there's direct pupillary response. Then I'm going to look at the other eye, it also constricts. So there's a direct and then consensual pupillary light response. Next, I'm going to do accommodation, so just follow the top of my pen, close to your nose. Okay, they constrict together, so there's accommodation, so your pupils are equal, round, reactive light, and there's accommodation. Have you had any vision changes lately or anything like that? Okay, and also your pupils are 4 millimeters inside. Next, I'm going to assess your nose, look at the external structure. It seems to be midline, which is good. Have you had any nasal drainage or anything?
No.
Okay, perfect. Next, I'm going to look in your mouth and look at your neck. So just open up for me. Okay, oral mucosa is pink and moist. Your teeth do not seem to be decaying at all. Have you any trouble swallowing or anything like that?
No.
Okay, perfect. And can you swallow for me? Okay, perfect. Next, I'm going to look at your neck. Okay, your trachea is midline, which is good. So then we can move on to the neurological portion. Have you had any memory loss as of late? Okay, perfect. Next, I'm going to educate you on the Glasgow Coma Scale. So it measures consciousness after brain injury, and 3 parts of that are eye-opening, motor response, and verbal response. So next, we'll move on to the respiratory portion. We already got your vitals. Your respiratory rate was 16. Your effort of breathing and pattern all seem to be normal as well. There's no, it's not unlabored or anything, or it is unlabored. There is no labored breathing. Next, I'm going to listen to your breathing sounds on the 4 lobes on your anterior and posterior side, and twice or 2 lobes on your lateral. Doing the correct pattern directly on skin. Sounds normal there. I'm going to do back, following the same pattern. And twice on your lateral side. So it's normal, nothing abnormal, no crackling, popping, or anything like that. Next, I'm going to educate you on the turn, cough, and deep breathe technique. So you would breathe deeply, you would then turn and then cough, which helps. Breathing deeply would help move the mucus up, and the coughing would get rid of it. So this would help kind of opening up the airways, help with breathing. I'll also educate you on the incentive spirometry, which is this. So for this, you would breathe in deeply, hold for like 3 to 5 seconds, and then exhale. And for that, you would exhale if you had the cough. You would then cough if necessary, and you do this 10 times every hour. So this would help breathing, once again, clean the airways as well. So have you had any sputum or cough or anything as of late?
No.
Okay, and no trouble breathing or anything?
No trouble breathing.
Okay, perfect. Next we'll move on to the cardiovascular portion. So I'll check for jugular vein distension. So I'm gonna look at your neck. Normally we would do this at 30 degrees, but it's here at 30 degrees. Okay, there doesn't seem to be any distension there, which is perfect. Next I'm gonna assess your pulses. So I'll first start with radial. So it's gonna be in your wrist, inside, okay? Then I'm gonna check the dorsalis pedis, which is on the top of your foot, and posterior tibial, which is on the inside ankle area. Okay, they all have a strength of 2+, normal rhythm. And I'm also going to note a few other pulses, such as your carotid, your popliteal, your brachial, your femoral, and your axillary. All those things. Next, I'm going to assess for edema on your upper and lower extremities. So I'm just going to squeeze. No edema or anything. Next, I'm going to listen to some heart sounds using my diaphragm directly on skin once again. To do aortic, pulmonic, curves, tricuspid, and mitral. I'm also going to listen here for a minute for the apical. Okay, it's normal rate. Once again, we already got your vitals, so you have a rate of 70. And I use the diaphragm, listening for those higher sounds, such as S1 and S2, which are normal heart rhythms. I would use the bell, the opposite side, if I was listening for lower rhythms, such as S3 and S4, but nothing was abnormal there. Have you any chest pain or anything as of late?
No.
Okay, perfect. Next, we'll move on to the GI portion. Can you lay down for me, please? Okay. So I'm going to inspect your abdomen. Looking at pigmentation, color, seems to match ethnicity, as well as there's no bumps, bruises, lumps, or lesions or anything like that. Next, I'm going to listen to your vowel sounds, starting in the lower right quadrant and moving in a clockwise position. Okay, normal active vowel sounds, nothing abnormal. Next, I'm going to palpate lightly, following the same pattern. Moving in a circular motion. Okay, doesn't seem to be any enlarged organs or anything like that, and no lumps. So then you can sit up again. And when was your last bowel movement, and have you passed any gas lately?
Last night, yes, I passed gas.
Okay, perfect. Have you had any abdominal pain or anything like that either?
No, I've done no pain.
Okay, and when was the last time you urinated or voided?
This morning.
This morning. Okay, perfect. Next, we'll move on to the musculoskeletal portion. So I'm going to assess the upper and lower extremities. So the upper extremities, I'll assess your elbow. So just flex and extend it for me. Okay. No popping or scraping. Same with the other side. Extend. Okay. No popping. Any pain there or anything?
No pain.
Okay, perfect. I'm going to do it with the wrist. Same thing. Just flex and extend it for me. No popping or scraping. Same thing. Okay. No pain or anything?
No pain.
Okay. And then push against my hands. And then pull.
Sorry.
Oh, you're really strong. So range of motion and strength are normal. Your strength is 5. So I'm gonna do the same thing with your lower extremity, or your lower extremity. So I'm gonna do with your knee, same thing. Flex, extend. Okay, no popping, scraping. Other knee as well. Okay, no popping, scraping. Any pain or anything?
No.
Okay. Do your ankle, same thing. And the other side. Okay, no popping, scraping or anything, or no pain either. Okay. Then once again, push against my feet. Pull. Okay. Strength of 5, and the range of motion is there. So next, I'm going to assess gait and balance. So can you walk a little across the room? And come back. Okay, gait seems to be normal. Then we're going to assess balance. So you can do the same thing, but just heel to toe. Okay. Okay, perfect. Gait and balance seems to be okay. Have you had any trouble walking as of late?
No.
Either? Okay. That's everything.
You can look at your thing if you want.
Oh, yeah, right.
Make
I can't be told. Okay. Let's count that. Question, no, sounds. Oh, yeah, okay. Yeah, you guys are baskets. Can you lay down again? Assess vascular sounds in your patient. I'm using the bell. Listen to aortic, renal, iliac. Okay, no brutes, no normal sounds or anything.